Hi, my name is Mark Augustyn. We're here today at the All Things Healing Studios with Dr. Taseem Bhatia, who is the editor of the Integrative Medicine section of the website. I guess we'll get started. Dr. Bhatia, what is integrative medicine?
Absolutely. Well, thanks for having me.
You're very welcome.
Integrative medicine is an exciting new field in medicine where a lot of physicians are getting additional training where they learn to combine standard conventional medicine, which is what we learn in medical schools, along with some of the healing therapies from around the world. So, for example, combining your classic cholesterol medications with maybe nutritional or diet changes, or with some Ayurvedic remedies, or with acupuncture or herbal remedies. So it's a way of kind of bringing together the collective knowledge of medical care and trying to create the best plan for a patient.
All right. What can a patient expect when they visit an integrative medicine specialist like yourself?
That's a very good question. Typically, most integrative medicine consults are pretty involved. The nature of integrative medicine, we believe that it's not just the symptom that you're having that we need to deal with, but how that symptom plays out throughout your entire health history, your energy, your activity level, your relationships. So most integrative medicine consults can be initially about an hour or so long, where the physician will sit down and look at your history, your medications, your relationships, your stress level, your past medical history, and just get a good feel for who you are as a patient. From that point forward, then that physician usually tries to develop a treatment plan for you that may suggest a variety of different modalities, as we just mentioned, things like acupuncture, herbal medicine, nutritional support, and then we'll have a plan usually for follow-up.
Now, how does a patient go about choosing an integrative medicine specialist, and what kind of training goes into that field?
There seems to be, that's a good question, because there just seems to be a lot of confusion about what an integrative medicine physician is and what their background is. Integrative medicine physicians are physicians that have a typical MD, they have a medical degree, but they've gone beyond that medical degree to pursue training in this field. Now, there are different ways to get that training. I recommend and I really hold in high regard my mentor, who's Dr. Andrew Weil out at the University of Arizona. He has created a fellowship for physicians so that they can be trained in integrative medicine. He has graduates now all over the world, and many obviously here in the United States. So that's one way, is to maybe go onto his website. It's the School of the Fellowship in Integrative Medicine at the University of Arizona, and see who's practicing in your particular area. Beyond that, there are a lot of physicians who have trained by doing a board exam in holistic medicine through the ABHIM. So that's another organization that patients can look to for some support as well. But the key is just really making sure your physician has tried to get additional training beyond their med school training. What have they done? Have they done nutritional certifications? Have they learned acupuncture? Did they learn Ayurveda? Did they go out and follow people in other countries or follow other physicians in other countries? But we really want to make sure patients are choosing a physician that has actively pursued this training, rather than just sort of jumping on the current trend of calling themselves an integrative physician.
Now, you are the editor of the Integrative Medicine section at All Things Healing. What can a visitor to the site expect when they come to the Integrative Medicine section of All Things Healing?
Well, what we're hoping is that when you come visit our page, that it will help you in a lot of the things we just talked about. It will help you in choosing an integrative medical practitioner, and then it will just help a patient on a basic knowledge base. For example, every month we plan to have a theme and have articles and content associated with that theme. And I think our next rollout will be on brain health and brain balance for people with bipolar or anxiety or ADD or ADHD. Hopefully having a wealth of content there, so a patient can come and educate themselves about what some of the potential opportunities are to heal themselves, and also help them find a practitioner that will assist them on that journey. So we're trying to really help the patient be as educated as possible, and also help them find a provider that can help them in that process.
Right. Well, it sounds like great work.
Thank you.
Dr. Bhatia, so appreciate you coming down to the studio today. Dr. Taseem Bhatia, Mark Augustyn with All Things Healing. We'll see you guys soon. Thank you.